Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Look at insomnia differently tonight. Do not think of it only as "I cannot sleep." Think of it as a nervous system that has failed to downshift. Ask yourself, why does the body lie still while the brain keeps acting as if it is daytime? Why does exhaustion sometimes make sleep harder instead of easier? How can a mineral, something as ordinary as magnesium, matter in a process as complex as sleep? Here is the key idea. Magnesium is not a sleeping pill. Do not treat it like one. Treat it as a biological stabilizer. It does not force unconsciousness. It helps the body create the conditions in which sleep becomes more likely. That distinction matters. Insomnia often involves hyperarousal. The brain stays alert, the muscles remain subtly tense, stress chemistry runs too high at the wrong hour, and the person begins to fear the bed itself. So begin there. If the body is running a nighttime alarm mode, ask, how do we lower the alarm without simply sedating the person? Magnesium may help because it participates in nerve signaling, muscle function, blood pressure regulation, glucose metabolism, and many other basic physiological processes. The National Institutes of Health describes magnesium as necessary for regulating muscle and nerve function, blood sugar, blood pressure, and making protein, bone, and DNA. In other words, magnesium is not an accessory nutrient. It is part of the body's electrical and biochemical grammar. Now listen carefully. The strongest clinical answer for chronic insomnia remains cognitive behavioral therapy for insomnia, known as CBTI. Do not replace proper diagnosis, behavioral treatment, or medical care with a supplement. The American Academy of Sleep Medicine gives CBTI a strong recommendation for chronic insomnia in adults, so place magnesium where it belongs, as a supportive tool, especially when low intake, muscle tension, stress activation, nighttime restlessness, or older age may be part of the picture. Start with the first mechanism, nervous system braking. Why does magnesium feel calming for some people? Because the sleeping brain must shift from excitation to inhibition. During the day, the brain uses excitatory signals to focus, react, solve, scan, and move. At night, that system must soften. One of the major calming pathways is GABA, the brain's primary inhibitory system. Another major excitation pathway involves glutamate and NMDA receptors. Magnesium is discussed in the medical literature as supporting GABAergic activity and acting as a natural regulator of NMDA-related excitation. A 2025 narrative review in Nature and Science of Sleep describes magnesium in insomnia as an adjuvant therapy that may act through NMDA antagonism, GABA-related effects, and relaxation pathways, while also noting that the full crosstalk among these systems is still being clarified. So ask the audience, why do some people feel tired but wired? How can the body be exhausted while the brain refuses to surrender? Because tiredness and sleepiness are not identical. You can be tired from stress but still chemically activated. You can be physically drained but still neurologically guarded. You can lie down at 11 p.m. while your stress system behaves as if it is 11 a.m. Tell the body what to do. Reduce the signals of threat. Dim the lights, lower stimulation, stop negotiating with your phone, keep caffeine away from the second half of the day, and if magnesium is appropriate for you, use it as part of that downshift, not as an emergency button after 3 hours of frustration. Now move to the second mechanism, muscles. How often does insomnia hide in the body, not only in the mind? Notice the jaw, notice the shoulders, notice the calves. Notice the restless shifting in bed. Many people describe insomnia as a thinking problem, but their body tells another story. Tight neck, clenched hands, shallow breathing, twitching legs, or a sense that the mattress has become a battlefield. Magnesium matters here because muscle contraction and relaxation are mineral-dependent processes. When magnesium status is not adequate, the body may become more prone to cramps, tension, weakness, tingling, and neuromuscular irritability. The The NIH notes that more serious magnesium deficiency can include muscle cramps, numbness, tingling, seizures, personality changes, and abnormal heart rhythm. Do not jump to the conclusion that every cramp is magnesium deficiency. But do ask, is the body asking for mineral support before it can truly let go? Now develop the clinical evidence. In a double-blind, placebo-controlled clinical trial in older adults with primary insomnia, participants received 500 milligrams of elemental magnesium daily for 8 weeks. The magnesium group showed improvements in insomnia, severity, sleep time, sleep efficiency, sleep onset latency, and early morning awakening. The study also reported higher melatonin and renin levels and lower cortisol concentration in the magnesium group. That is important because it suggests magnesium may not merely affect feeling sleepy, it may influence the endocrine rhythm around sleep itself. Ask, why is cortisol so important? Because cortisol is not evil. Cortisol helps you wake, mobilize energy, respond to challenge, and survive. But timing is everything. Cortisol belongs higher in the morning and lower at night. If cortisol stays elevated when the bedroom is dark, the body receives conflicting instructions: rest and prepare. Magnesium may help some individuals by nudging that stress physiology toward a calmer nighttime pattern. Ask again, how does this become practical? Do not wait until midnight to build a sleeping body. Start earlier. Eat magnesium-containing foods during the day: pumpkin seeds, almonds, cashews, peanuts, beans, lentils, whole grains, spinach, yogurt, and other dairy foods if tolerated. Build the mineral foundation before the night begins. The NIH lists legumes, nuts, seeds, whole grains, green leafy vegetables, fortified foods, and some milk products as magnesium sources. Then consider supplementation only with judgment. Adults generally need about 420 milligrams per day for men and 320 milligrams per day for women from total intake, depending on age and situation. But the upper limit for magnesium from supplements and medications is 350 milligrams per day for adults unless a healthcare provider advises otherwise. This upper limit does not count magnesium naturally present in food. Pay attention to that distinction. Food magnesium is handled differently by the body than a large supplemental dose. Now bring in the broader review. A 2021 systematic review and meta-analysis looked at oral magnesium supplementation for insomnia in older adults. It included 3 randomized controlled trials with 151 participants. The pooled analysis found that magnesium reduced sleep onset latency by about 17 minutes compared with placebo. Total sleep time improved by about 16 minutes, but that increase was not statistically significant. The authors also warned that the quality of evidence was low to very low and that the trials had moderate to high risk of bias. So say this clearly: magnesium is promising, not magical. Use that sentence. Repeat it if needed. Magnesium may help some people fall asleep faster, especially older adults or people with inadequate intake, but it is not a universal cure. Why does that honesty make the recommendation stronger? Because serious health advice must survive contact with reality. Some people improve, some feel nothing. A smaller group may feel worse, especially if they take the wrong form, the wrong dose, or take it too late. Some people report vivid dreams, stomach upset, morning heaviness, or paradoxical wakefulness. So command the process. Test carefully, track results, and stop if it clearly worsens your sleep. Now discuss forms. Do not obsess over marketing language. Look at the elemental magnesium amount. Magnesium citrate, glycinate, lactate, chloride, and aspartate are often considered more absorbable forms than some others. The NIH Consumer Fact Sheet specifically notes that aspartate, citrate, lactate, and chloride are more readily absorbed. Magnesium oxide contains a high percentage of elemental magnesium, but it may be less gentle for some people and more likely to affect the gut. Magnesium citrate may loosen stools. Magnesium glycinate is often chosen at night because glycine itself can feel calming for some, but not everyone responds the same way. How should someone try it? First, check safety. If you have kidney disease, heart rhythm problems, severe gastrointestinal disease, or you take multiple medications, speak with a clinician first. Do not be casual here. The kidneys clear excess magnesium, and impaired kidney function changes the safety equation. Second, check medication timing. Magnesium can interfere with absorption of certain antibiotics and bisphosphonates used for osteoporosis. Diuretics can change magnesium loss through urine. Long-term acid-suppressing medicines can contribute to low magnesium in some people. High-dose zinc can interfere with magnesium regulation. So separate magnesium from interacting medications when advised, and ask a pharmacist if you are unsure. Third, start low. Do not begin with the biggest capsule because the label sounds impressive. Try a modest dose in the evening, often with food, and observe for 1 to 2 weeks. Many people think a sleep supplement must work the first night, but if the issue is mineral repletion, the effect may be gradual. Fourth, measure something. Do not rely only on mood. Write down bedtime, time to fall asleep, awakenings, final wake time, total sleep time, morning energy, and any side effects. Ask, how long did it take to fall asleep? How many times did I wake? How did I feel at 10 a.m.? The morning matters. A treatment that gives you sleep but steals your next day is not a good trade. Fifth, build the whole sleep environment. Magnesium cannot compete with bright light at midnight, late alcohol, untreated sleep apnea, panic, pain, reflux, stimulant medications, or a chaotic sleep schedule. Command the basics. Keep a consistent wake time, get morning light, reduce evening light, avoid heavy meals too late, cool the room, and get out of bed if you are awake long enough to become frustrated. Train the bed to mean sleep again. Now ask the central question: who may benefit most? Think of the older adult whose magnesium intake is low. Think of the person with muscle tension and nighttime cramping. Think of the person whose diet is low in nuts, seeds, beans, whole grains, and greens. Think of the person taking medicines that may affect magnesium status. Think of the person whose insomnia is mild to moderate and mixed with physical tension rather than severe psychiatric distress. In these cases, magnesium may be a sensible supportive strategy. But also ask, who needs more than magnesium? If insomnia is chronic, 3 or more nights per week for 3 months or longer, do not keep guessing. If there is loud snoring, gasping, morning headaches, high blood pressure, or daytime sleepiness, evaluate for sleep apnea. If there are crawling sensations in the legs relieved by movement, evaluate restless legs syndrome and iron status. If insomnia appeared after a new medication, discuss it with the prescriber. If depression, trauma, panic, mania, or substance use is involved, treat the larger clinical picture. Magnesium can support the terrain, but it cannot diagnose the landscape. That is the mature way to use it. And now, bring the idea back to the human experience. Most people with insomnia do not only want more hours, they want trust. They want to trust the bed again. They want to trust that closing their eyes will not begin another private battle. Magnesium may help restore part of that trust by calming the body's electrical tone, relaxing muscles, supporting stress hormone timing, and correcting insufficient intake when present. Do not sell it as a miracle. Present it as a quiet intervention with a plausible mechanism, modest clinical support, low cost, and real safety rules. So tonight, remember this: sleep is not something you attack. Sleep is something you permit. Ask, why is my system still on alert? How can I lower the signal? How can I support the body before asking it to sleep? Use magnesium wisely. Start with food. Consider supplementation carefully. Respect the dose. Check interactions. Track the outcome. Combine it with CBTI principles and healthy circadian habits. If the insomnia is persistent, severe, new, or connected to breathing problems, mood symptoms, pain, or medication changes, get medical help. Magnesium can be beneficial because it works with the body's own sleep biology, nerve calming, muscle relaxation, stress regulation, and sleep rhythm support. It can be effective for some people because insomnia is not always a lack of sedation. Sometimes it is a lack of physiological permission. Give the body that permission. Make the night feel safe again. Take care of yourselves, take care of each other, and I'll see you with our next topic. Same table, same family, one step healthier together.